Washington's clear thinking headquarters. The Morning Majority, 5 to 9 on 630 WMAL.
6:07 Morning Majority. Happy Friday to you, Brian Neiman. Byron York from the Washington Examiner in this morning. Peter Morici joins us now, University of Maryland economist, professor. Happy Tax Day, Peter.
Oh, I love it. I love it. Geez. Isn't it great to be an American?
Do you do anything special in your classes this time of year? Perhaps maybe dress up as King George for the students?
No, I don't do anything like that.
No.
Would I lower the dignity of my position
Yes.
with such a crass act? I mean, haven't you always noticed how I try to maintain a position of modesty and
Yes.
And professional decorum on WMAL?
Yes, I have noticed that. But as a
Haven't you
student,
yet?
I think it would be kind of fun for you to watch you dress up as King George or do something fun.
Well, I'll have you to class next year, and you can do it.
Absolutely, I'll be there. Give me the invitation.
Anyway.
I want to start off with the Republican plan, actually, for next year's budget. Paul Ryan's The Path to Prosperity. I know he's getting a lot of support, but you've been critical of the plan. Where does the Ryan doctrine go wrong in your mind?
Okay. Well, first of all, I'm all for cutting and downsizing, and I'm with him on that, and I thank him for joining the issue. But some of his suggestions leave me absent. For example, block grants to the states for Medicare, Medicaid, doesn't really solve the basic problem that we're paying too much for drugs and hospital care and so forth. And it just really shifts the problems down to the states and just shifts the budget problem around. It would be an enormous headache for them, and they wouldn't be able to solve it. The president, to his credit, did say something about doing something about drug prices, but generally his boards and commissions and all these Clara community activists from Harvard aren't going to solve the problem. So, I think we need more substance in the Ryan proposal for dealing with things like drug prices, hospital stays. We pay twice as much as the Germans do for things like that.
Well, the governors say that they kind of like that because it would give them more room to kind of do it on their own if they get these block grants. They're then in control of the program versus the federal government telling them what they have to do.
I appreciate that. However, I don't see how they can provide enough services if there's not enough money and the prices don't come down. And I don't know that they'll be in any better position to negotiate the prices down than they are now. I mean, I just don't think they're going to have the latitude.
Is this essentially a voucher program, what Ryan is proposing?
Well, the program for Medicare is. He's going to give the elderly. He says, by the way, in his plan, he says specifically it's not a voucher, but it is. He's going to give each person so much money to buy whatever. No, this is not a voucher program. What it basically does is give, for Medicaid, for poorer folks, the states, here's the money. You divide it up. You decide who gets covered. The only way you can deal with not enough money is fewer people covered, which might not be a bad thing with Medicaid,
right.
Or you have to provide with fewer services or lower the prices. And I don't know that the 58. Can you see Rhode Island negotiating with Pfizer on the price of a drug?
Hey, Peter, what about the Medicare plan, though? That is a voucher plan. Does that work in your view?
No, I don't think it does. Again, Medicare, the basic problem with Medicare is the drug program doesn't have formularies in it. And that is, there was a clause put in the Medicare law that said that the federal government couldn't negotiate prices so that the drug companies could charge whatever they like. And similarly, they pretty much set the price of hospital stays and so forth on a cost-plus basis. By the way, if you look closely, it's not what your doctor's being paid. It's all the bureaucracy that goes with it. Doctors' pay is not outrageous in the United States. I mean, there are some doctors that are making too much money. There are some specialties that have beaten the system. But when you visit your GP, that's not the landed aristocracy.
But if you have a voucher system, though, then don't you get rid of some of that bureaucracy? And then you kind of negotiate one-on-one with the hospital or the doctors?
My experiences with Aetna are that it's as bad as the IRS.
Yeah.
Okay? Let's get real. I mean, dealing with my insurance company is a nightmare, not to mention my drug coverage.
So then what is the answer for Medicare?
Well, my feeling is we have to start to look at the German and Dutch systems. They have a private system of health insurance. The government does reimburse 80% of health care costs as opposed to 55% here, but they simply do. They acknowledge there is no private market in health care, and they regulate the prices directly and effectively. No one has been willing to admit that. It's an anathema to Republicans, but some things the private sector doesn't do well. That's why we have an army.
Peter,
okay? I hate to sound like a liberal, but I don't want to go to a single-payer system like the English have. By the way, we have found that both single-payer systems and private systems of the German type both work well. It depends on the culture of the country. And culturally, this country ain't doing a single-payer system.
No,
We're not structured that way.
Peter, shifting over to the president. Peter, shifting to the president's speech, he seems to believe that the Bush tax cuts are the source of all evil in the world. I mean, it's been a while, but he's still saying that, isn't he?
I know. Well, look, all I can say is let's look at the data. That's always helpful in economics, you know. What's the price of gasoline? That tells me if it's expensive. In 2007, that was the last year before the crisis, with 2 wars raging and the Bush tax cuts in place, the deficit was $161 billion. In comes Nancy Pelosi and the Democrats. They increased spending by $1.1 trillion. By the way, $200 billion would have been enough to cover inflation using their inflation numbers. Okay, that means they increased spending by $900 billion. They increased the federal share of spending, by from less than 20% of GDP to more than 25% of GDP. No, Congressman Ryan is right on. This is not a tax problem. This is a spending problem. What are we getting today that we weren't getting in 2007? The answer is essentially a Medicaid program that now is covering middle-class children, and a lot more bureaucracy, which, by the way, isn't protecting you from the abuse of your bank or credit card companies any better than it was before.
So are the Republicans right then when they say no tax increases, we are not going to fix our debt problem with increasing taxes? Or, couldn't tax increases be a part of the long-term solution?
I think that Congressman Ryan's got it right. So at the end of the day, if I have to put my money on Ryan or Obama, I'm putting it on Ryan. In fact, I got a note correcting an error that I made in an article, which I appreciated, from his press secretary, and I wrote him back and said, thank you. And by the way, while I've criticized some of the stuff you've done, thank you so much for doing this.
Okay, but are you more optimistic today than you were, say, last week about actually getting on the right track in this country?
Actually, I think that Obama's winning the rhetorical battle, and the Democrats are. I think that is a problem for Ryan and company. For example, he began his speech blaming the Bush tax cuts. I haven't heard Congressman Ryan lay out the data that I just laid out to debunk that and put it aside once and for all. I mean, they should be better at dealing with the president's rhetorical offensive, and they're not.
But do you think Republicans are wise to attack this now, or do you think that the Ryan plan, which is 73 pages long, really is the world's longest suicide note?
Well, it could well be the world's longest suicide note, but if not now, then when? And if not them, who?
All right. Well, all right. So why doesn't Paul Ryan, why doesn't the President of the United States ever talk about Social Security? To me, the Social Security fix is pretty simple. You just raise the age, right?
Yeah, it's pretty simple, and it's pretty deadly.
But why is it deadly?
Nobody wants to tell the American people what guys like me have been writing, because I don't have to get elected. I got tenure.
Yeah.
Basically, you have to raise the retirement age to 70 for everybody under 55. And to show you that I'm in on it, even though I'm 62, if you do that, I'll work till I'm 70 as well. And people can verify that. Not that anyone cares. But that's the only thing. The bottom line here is that people are living longer. So the ratio of retired people to working people is too high. And we simply have to work longer. And we're capable of working longer. But every time we get into a discussion of this, the Democrats want to create a new entitlement for people in difficult jobs so they can retire at 62. No, we should do for them what the private sector already does in non-unionized areas. If you look at the construction trades, they start to put aside jobs like estimators and office jobs for the older workers, which is what you need to do.
Let me ask you one more question about the Ryan budget. He says it's going to save trillions of dollars over the long run, but it apparently doesn't actually balance the budget until 2030s or
late 2030s.
Yeah, late 2030s. So how is that possible? How can we not have a balanced budget until 2038 or whatever?
Well, that's up to him. I want to take back that $900 billion in extra spending, and that would get the budget deficit down to $600 billion. Getting it below that would be tough. Because then you'd have to start really doing something about Medicare and Medicaid, as they were in, say, 2007, and that would really, really be tough to do overnight. You don't just rewire 20% of the economy, overnight. So I think that it's a matter of who brings it down the most now, not a matter of who brings it down to zero.
But why is it safer to go after Medicare than it is to go after Social Security?
I'm not a politician. I'm an economist. Well, the point is that...
Well, Harry Reid said you cannot go after Social Security because Social Security supports itself. It's not broke. It's doing fine.
Well, that's nonsense. It isn't doing fine. They're now cutting... they're now cutting into the interest in the trust fund. It's no longer taking in more than it's paying out, and in a couple of years they'll be going into the principal, and it'll be busted in 2033. If he would like to wait till say 2025, when everybody's in a panic about the system going away in 8 years, well, that's great, but I don't want to play the game that way. I don't know that it is any longer politically more dangerous to touch Social Security, because I think that Congressman Ryan's Medicare proposal, and that is privatizing it, when most Americans know that Aetna and Company and Humana and so forth are even tougher to deal with than the Medicare people, is not itself political suicide. Unless they come up with a tangible program to lower drug prices and the cost of hospital stays to the level in Germany. We pay $8,000 a year for health care. They pay $4,000 per person. Until we start to take a hard look at what the Germans and the Dutch do, and start to pattern our system after them, we are simply not going to come up with a plan that is politically acceptable to people, because they're going to be quite afraid of how they're going to be treated in their old age.
Thank you, Peter. As always, we appreciate your time. Good